Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're tackling a condition that often is misunderstood, but can greatly impact a person's daily life. It's called interstitial cystitis, also known as bladder pain syndrome. It's more common than most people realize, and yet many who suffer from it go undiagnosed or misdiagnosed for years. So, what is interstitial cystitis, and why does it cause so much discomfort? And more importantly, what can be done about it? To help us understand this complex condition, we are joined by a true expert in integrative and regenerative medicine, Dr. Bryn Henderson, a board-certified physician and medical innovator known for blending traditional and regenerative treatments to offer new hope for chronic conditions. He's focused on healing the whole person, not just the symptoms. All right, so let's begin with the basics. What exactly is interstitial cystitis?
Interstitial cystitis, or IC, is a long-term condition that causes pain, pressure, and a lot of suffering. It's in the bladder and the pelvic area. The people with IC often feel like they have to urinate all the time, even if their bladder is not full. Unlike a regular bladder infection, there's no bacteria causing this. It's inflammation and hypersensitivity of the bladder wall, which can be very frustrating and painful for patients.
Well, that sounds difficult. Who is most likely to get this condition?
IC tends to affect women more than men, especially those over 40. Genetics might play a role. It runs in families, and it also seen more often in people who have other chronic pain conditions like fibromyalgia or irritable bowel syndrome. High stress and past trauma can also be contributing factors.
What are the common symptoms that patients usually report to you first?
The big ones are bladder pain or pressure in the pelvis that gets worse as the bladder fills, a constant need to void or pee, and a feeling like you can't hold it. Many patients also experience pain during sexual intercourse, pelvic discomfort, and flare-ups tied to their menstrual cycle. Stress or even specific foods like caffeine and spicy meals can add flames to the fire.
So, how do you go about diagnosing interstitial cystitis?
We start by ruling out other causes, like infections and kidney problems. Then we listen to the patient's history. Symptoms lasting over 6 weeks, pain without an infection, frequent urination. We might do a urine test for sure, and we use symptom questionnaires, sometimes perform a bladder scope called a cystoscopy to look inside the bladder and check for something called Hunner's lesions, Hunners, are small areas of inflammation, and they're everywhere in that bladder.
All right, so what do they look like when the doctor's looking in the bladder?
Sure, Hunner's lesions are inflamed patches on the bladder wall that can bleed when the bladder stretches. Not every IC patient has them, but for those who do, the pain is usually more severe, and these patients may need more specific treatments, like cauterizing the lesions or steroids directly into the bladder.
Okay, so what are some other options if someone goes, I don't really feel like having you experiencing that kind of pain, doctor? Do you have anything else for me? Plan B, column B?
The treatment is really very personal. There's no question about it. And you start with lifestyle changes and see if that really helps. Avoiding trigger foods, stress management's a big deal. And so is pelvic floor therapy, and they have very good pelvic floor therapists. Medications can include bladder lining protectors like Elmiron, as well as other low-dose medications, antidepressants, antihistamines. We can place those medicines sometimes directly into the bladder or use nerve treatments like Botox which is a paralytic and can paralyze some of the bladder. Last and the most common now is becoming electrical stimulation because you just flip a switch. It's so easy.
And what does the electric stimulation do?
It stimulates the nerves within the bladder and overrides it so that you don't feel the pain while we treat it.
All right, so let's talk about alternative and regenerative options, which you happen to have been doing for many a moon.
Yeah, we're very exciting results here. The regenerative therapies, especially using cells that are umbilical cord or exosomes, and even amniotic, can help heal the bladder lining and reduce inflammation. You can also use platelet-rich plasma, which is the patient's own blood after it's had a couple of spinning, and the plasma is in the top part, the supernatant, and it's harvested and combined with exosomes. These are nano size, the healing messengers from the stem cells. These are injected directly into the bladder to help repair and regenerate the tissues.
All right, so we have all these things. It really sounds good. I especially like the PRP because it's the patient's own body and the side effects are minimal. You know, a lot of people don't like needles and don't want to have blood drawn.
Well, that's true, but the balance here is relief from long-term severe pain. Their side effects are very minimal, and you may have mild discomfort from a blood draw, but that's nothing compared to what they're suffering. There's huge improvements in their pain, bladder control.
All right, so you talked about physical therapy, helping with the pelvic floor, strengthening. Let's talk about that.
Well, many patients have tight, overactive pelvic floor muscles, which can add to their pain. So you get therapy from a physical therapist or kinesiologist that helps relax those muscles, release trigger points, and improve posture. It's one of the most effective non-drug treatments we have for anything happening in that pelvis.
All right, so how does it look for long-term care with someone with IC?
That's a good question. IC is a chronic condition for sure, and so regular follow-ups are key. We monitor those symptoms, adjust the treatments as necessary, and address related issues like anxiety, sleep. Many of these patients have triggers that vary as they age. And after we help them, they can live full lives. And with the right care, it's about building a personalized plan that works for them.
So, Dr. Henderson, as we wrap up, what lasting advice would you offer patients who are living with interstitial cystitis or they know somebody that has interstitial cystitis?
Well, the first thing I'd like to say is you're not alone. These are very real, practical steps that can be taken by you to feel better. One of the tools I give my patients is called Bladder Calm. Bladder Calm is a mnemonic. It's a day-to-day strategy that combines lifestyle, self-awareness, and medical support.
All right. So B stands for?
Bladder training. Gradually increase time between voids.
L.
Low acid diet. Avoid citrus coffee and anything spicy.
A.
A is avoiding bladder irritants like fragrant soaps and tight clothing and harsh meds.
D.
Just drink water wisely and constantly. Stay hydrated.
D.
Just document the symptoms and triggers and keep a bladder diary daily.
E.
Exercise gently. Light movement relieves tension and stress.
R.
Relax those pelvic muscles. Pelvic floor therapy reduces spasms and pain.
C.
Consider medications, oral meds, bladder installations, antihistamines.
A.
Avoid holding in your urine too long. Empty often to avoid stretching the bladder.
L.
Learn coping techniques. Counseling and support groups help emotionally.
M.
Monitor with your doctor. Those check-ins are key to long-term care. This plan helps patients feel more in control because remember, it's changing as you age. And even small improvements can lead to big changes in the quality of your life.
Well, interstitial cystitis may not be widely known, but its impact is very real. The good news? Hope is growing with new therapies, personalized care, and the power of regenerative medicine. Healing is possible. Thank you, Dr. Henderson, for sharing your expertise today and helping us with this condition. And thank you to all our listeners for joining us. Remember, healing begins with understanding. So, if you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.